Welcome to the deep dive. Today, we're tackling something that might have popped up in a medical report for you, or maybe even your pet, Crystalluria.
That's right.
We're going to explore what it actually means when these, well, tiny crystals are found in urine.
Exactly. It sounds, pretty technical, but understanding it can give you some really valuable insights into what's happening inside the body.
Yeah.
You might be looking into this because of, say, a recent vet visit or maybe something in your own health journey.
Yeah.
So our goal today is to go beyond just a simple definition.
Right. Our mission with this deep dive is really to understand why the presence of these crystals matters. We want to help you distinguish when it might just be a harmless thing, something passing, and when it could actually be a signal of something more significant.
hmm
Ultimately, we're aiming to understand how doctors and vets actually interpret these microscopic findings. We've been looking at some detailed excerpts from medical texts to get a clear picture.
And the key thing to understand right off the bat is this. Seeing crystals in urine isn't always a red alert,
Huh?
but it can be a really important clue about potential underlying conditions and a significant risk factor for developing urinary stones, which doctors often call urolithiasis.
Okay, urolithiasis, got it. So let's start with the basics then. What exactly is crystalluria?
So, in simple terms, crystalluria is just the presence of crystals in urine. That's it.
Okay.
Now, the reason these crystals appear is because the urine has become supersaturated with certain substances.
Super saturated, like too much stuff dissolved in it.
Exactly. Think of it like making, I don't know, strong iced tea. If you stir in way too much sugar, eventually some of it will settle at the bottom because the water just can't hold anymore.
Right, it can't dissolve at all.
The same sort of thing can happen in urine with various minerals and other compounds.
So it's all about the urine getting too concentrated with certain things.
Precisely. And this is a really, really important point to remember. Just finding crystals doesn't automatically mean someone has urinary stones or is definitely going to develop them. It's more like seeing the ingredients, the raw materials that stones are made of, not, the finished stone itself.
Ah, that's a good analogy. Ingredients, not the final product.
Exactly. However, the presence of certain types of crystals, like cysteine or maybe urate crystals, those could be a much stronger indicator of underlying health issues.
That's a really helpful distinction. Okay, so when should we pay closer attention? When does finding these crystals become like a significant finding?
Well, looking at urine crystals helps in a few key ways. First, it can help doctors and vets identify if someone has an underlying condition that makes them more likely to form stones, down the line.
Okay, like a risk assessment.
Kind of, yeah. Second, by identifying the specific types of crystals they see, we can get a pretty good idea of what any existing urinary stones might be made of.
That makes sense, like figuring out if you're dealing with a sugar cube or a salt crystal so you know the best way to maybe dissolve it or treat it.
Exactly right. And third, if someone is already being treated for urinary stones, monitoring the crystals in their urine can help us see if the treatment is actually working.
How so?
Like, are we seeing fewer of the problem-causing crystals, for example? That would suggest the treatment is heading in the right direction.
Okay, so sometimes it's just a little bit of sediment, almost, and other times it's a sign of a bigger issue. How do we tell the difference between what's likely harmless and what could be a cause for concern?
Well, in people or animals with healthy urinary systems, occasional crystals can show up, and usually it's not a problem.
Hmm.
The body is generally quite good at just flushing them out naturally before they can clump together and form stones.
Like dust bunnies under the sofa, usually you just sweep them away.
Sort of, yeah. It's often there, but you usually clear it out before it builds up into something major.
But there are definitely situations where finding crystals is more significant, right? You mentioned specific types.
Absolutely.
Oh.
Detecting very specific types, even if the person or animal isn't showing any other symptoms at all, that can be a red flag.
Like which ones?
For instance, finding cysteine crystals or maybe ammonium urate crystals.
Mm-hmm.
That often points towards an underlying metabolic issue that really needs to be investigated further.
Okay.
It's like finding a very specific, unusual weed in your garden. It might tell you something important about the soil conditions, something systemic.
Got it. Certain types act as early warnings even without obvious symptoms. What else should make us take notice?
Well, if we frequently see large clumps or clusters of crystals,
Yeah.
even in someone who seems perfectly healthy, that can also be concerning.
The clumping matters.
It does.
Yeah.
Crystals like calcium oxalate, which is pretty common, and magnesium ammonium phosphate, sometimes called struvite,
Hmm.
they can form these larger aggregates. Seeing those often suggests a strong tendency towards crystal formation is present.
Like seeing a lot of sand starting to pile up in one spot, it suggests it might eventually form a dune, or in this case, a stone.
That's a good way to put it. The quantity and the aggregation, yeah, they matter as well as the type. And of course, if someone has already been diagnosed with urinary stones, then finding any crystals in a fresh urine sample is significant.
Why is that?
It indicates that the conditions within their urinary tract, the environment, are still favorable for forming more stones.
Right, means the stone-making factory is still, open for business?
Precisely. And finally, one more thing. We need to consider if someone is taking certain medications.
Ah, yes, you mentioned that briefly.
Some drugs, like allopurinol, or certain antibiotics like sulfadazines or fluoroquinolones, they can actually form crystals themselves if they get too concentrated in the urine.
Really, the drugs themselves crystallize.
Yes, in high enough concentrations. So if we see these drug-related crystals, it can be a concern because they can contribute to forming actual drug-containing urinary stones. And it might mean the medication dosage needs to be looked at, maybe adjusted.
So it's not just about what the body produces naturally, but also what we might be putting into our systems through medication. Okay. Now, let's talk about what actually causes these crystals to form inside the body, the in vivo factors, as the texts call them.
Right, in vivo. Well, the main factor is just the concentration of the substances that can form crystals within the urine itself.
Okay.
And this concentration is affected by two main things.
Mhm.
How much of that substance the body is getting rid of, its excretion rate, and how dilute or concentrated the urine is, which of course depends on things like how much water someone is drinking.
So if you're dehydrated, maybe running a marathon, or just not drinking enough, you might be more prone to forming crystals.
Absolutely. Less water means more concentrated urine. That increases the chances of these substances reaching a point where they can no longer stay dissolved
Mhm.
and they start to crystallize out.
Makes sense.
Another really important factor is the pH of the urine, basically, whether it's acidic or alkaline. Different types of crystals are much more likely to form at different pH levels. For example, struvite and calcium phosphate, they tend to form in urine that's neutral to alkaline.
Okay.
Whereas others, like ammonium urate, sodium urate, calcium oxalate, cysteine, and xanthine, they're more common in urine that's acidic to neutral. It's like different plants thriving in different types of soil, you know?
That's fascinating. The acidity or alkalinity of your pee can actually influence what kind of crystals might show up.
Exactly. Then we also have just the inherent solubility of these substances in urine. Some things are just naturally less soluble than others, making them more likely to crystallize out if conditions are right.
Okay.
We also need to think about the excretion of diagnostic agents, like the contrast dyes used in some medical imaging scans.
Oh, like for CT scans or something.
Yeah, those can sometimes cause temporary crystalluria. And as we mentioned, certain medications can definitely contribute. Even diet can play a role. What someone eats regularly can affect the levels of certain potential crystal-forming substances in their urine. And even when a sample is taken, like after fasting versus after a meal, can sometimes influence whether crystals are seen or not.
Wow. It sounds like a lot of different internal factors can contribute to these microscopic formations. But what about what happens to the urine after it leaves the body? The in vitro factors, why do those matter?
Well, these are crucial because changes can happen in the urine sample itself after it's been collected, and these changes can lead to crystals forming that weren't there originally, or even cause existing crystals to dissolve.
Seriously, so the sample itself changes?
Yes. Temperature is a big one. As urine cools down from body temperature to room temperature, or especially if it's refrigerated, some substances become less soluble and can crystallize out.
Okay, so cooling is bad if you want an accurate picture.
Generally, yes, for assessing in vivo crystalluria. Evaporation can also concentrate the sample if it's left sitting open, changing saturation levels. The pH of the urine can also drift after collection, becoming more alkaline, for instance, which could favor struvite formation. And even just how the lab handles the sample, whether they spin it down in a centrifuge to concentrate the sediment or not, and how much of the sample they actually examine under the microscope, all of that can affect what they report.
So the urine sample is almost like this little microenvironment that keeps changing even after it's, well, outside the body.
Precisely.
Mhm.
And this is why it's really important that if we need to know what was happening inside the body in terms of crystal formation, we should ideally examine a fresh urine sample as soon as possible.
Like right away.
Ideally? Yes, and even keeping it at body temperature, if possible, is the gold standard, though often not practical. If that can't happen, examining it at room temperature fairly quickly is the next best thing.
And definitely don't stick it in the fridge.
Refrigeration should generally be avoided if you're specifically interested in vivo crystals, because cooling strongly encourages certain types, like struvite and calcium oxalate, to form in vitro.
Gotcha.
And one more simple thing, even something like using a dirty collection container can introduce junk, spurious crystals that weren't actually in the urine to begin with.
That makes perfect sense. You want a snapshot of what was happening inside, not something that developed on the lab bench afterwards. Okay, now let's get into the specifics of different crystal types. What can the appearance of each type tell us? Let's start with the urates.
Right. Ammonium urate, sodium urate, and what we call amorphous urates, those sort of nondescript granular ones, they aren't commonly seen in healthy individuals. If
Okay.
you find them, especially repeatedly, it often suggests an underlying issue. Things like a portal vascular anomaly, which is a blood vessel abnormality affecting the liver.
Ah, the liver connection.
Yes. Or maybe a genetic predisposition to having high levels of uric acid in the urine, a condition known as hyperuricosuria. So these urate crystals often act as a clue, pointing towards something else going on with the body's metabolism, often involving the liver or purine breakdown.
So these specific urate crystals are often assigned to dig deeper, look for something systemic. What about bilirubin crystals?
Bilirubin crystals, they're usually yellow-brown needles or granules related to the breakdown of red blood cells and hemoglobin. They can sometimes be found in small amounts in really concentrated urine from healthy individuals, especially dogs.
Okay, small amounts might be normal-ish.
Possibly in concentrated samples. However, if we consistently see large amounts of them in multiple urine samples taken over time, particularly in cats, it could indicate a problem with how the body is processing bilirubin, maybe liver disease or excessive red blood cell breakdown.
So tracking these over time, serial monitoring is important for bilirubin.
Yes, exactly. Consistency and quantity matter there.
Okay, what about the really common ones? Calcium oxalate crystals. I feel like I hear about those a lot.
Yes, calcium oxalate is very common. They can come in different shapes. The classic one is the dihydrate form, which looks like a little square envelope under the microscope.
Oh, neat.
And then there's the monohydrate form, which can look more like dumbbells or ovals or picket fence posts.
Okay.
Now, these can be seen in healthy individuals sometimes, just, transiently. But they're also the most common type found in urinary stones, especially in dogs and humans.
So seeing them could mean stones, or it could mean nothing.
It could mean either, which is why context is key. But interestingly, the monohydrate form, those dumbbell or picket fence shapes, is strongly associated with ethylene glycol poisoning.
Antifreeze.
Exactly, antifreeze. Finding calcium oxalate monohydrate crystals in an animal suspected of ingesting antifreeze is a very significant finding.
Wow.
However, and this is really important, just because you don't see these crystals, doesn't completely rule out antifreeze poisoning. They might not have formed yet, or they might be sparse.
Okay, that's a really critical point. So finding them is a strong clue for poisoning, but not finding them doesn't give you the all clear.
Precisely. Don't rely on their absence to rule it out.
Yeah.
Okay, then we have calcium phosphate crystals.
Right.
These often look like prisms or amorphous granules. Finding larger amounts of these in individuals who seem healthy but consistently have alkaline urine.
Oh.
That can happen. They're also seen in animals that form calcium phosphate stones or mixed stones containing calcium phosphate.
Okay.
You might also see smaller amounts of calcium phosphate crystals alongside struvite crystals when there's a urinary tract infection causing alkaline urine.
So they can tag along with infections sometimes?
They can. Additionally, calcium phosphate crystalluria can sometimes be linked to conditions like primary hyperparathyroidism, which causes high blood calcium, or certain types of kidney problems called renal tubular acidosis. So again, a few different potential underlying connections.
It really sounds like for many of these, there's often more than one potential explanation. You need the whole picture.
Absolutely.
Mm-hmm.
Now, cystine crystals are different. They have a very characteristic flat hexagonal shape, like little stop signs.
Hexagons.
Seeing these is a pretty strong indicator of an inherited metabolic disorder.
Yeah.
It's called cystinuria, and it affects how the kidneys handle cysteine and some other amino acids. So finding cystine crystals almost always points to this specific genetic condition.
So that one's more definitive.
Generally, yes.
Yeah.
Much more strongly linked to a specific underlying disease. Then there's struvite, which is magnesium ammonium phosphate. These often look like coffin lids, rectangular prisms.
Coffin lids, memorable.
Very. Struvite is quite interesting. It can be found sometimes in healthy individuals, especially if the urine sample sits and cools and becomes alkaline, but it's also strongly associated with urinary tract infections, particularly in dogs.
Why infections?
Because certain bacteria, called urease-producing bacteria, break down urea in the urine into ammonia. This makes the urine alkaline and provides the ammonium needed for struvite crystals to form. So in dogs, struvite stones are very often infection-induced. Interestingly, in cats and ferrets, while they can get struvite stones, they're less commonly associated with infection. They often form sterile struvite stones.
Huh, a species difference.
Yep. You can also see struvite crystals in animals with other types of stones, mixed stones, or even just general urinary tract disease without stones being present yet. So context, especially infection status and species, is really key for interpreting struvite.
That species-specific detail is really useful. What about uric acid crystals? You mentioned urates before.
Right. Pure uric acid crystals themselves are actually not very common in dogs and cats. They can look like diamonds or rhomboids, often yellowish. When we do see them, their significance is pretty similar to the ammonium and amorphous urates we talked about, often suggesting some kind of underlying metabolic issue, maybe liver disease or a genetic predisposition like in Dalmatians who are prone to urate stones.
Okay, so similar implications to the other urates.
Pretty much. Now, xanthine crystals, those are quite rare. They look like amorphous brownish-yellow globules. Seeing them might make you think that someone is getting too high a dose of the medication allopurinol.
What's allopurinol used for?
It's often used to prevent urate stone formation, ironically. It blocks an enzyme called xanthine oxidase. But if you block that enzyme and the patient is eating a diet high in purines, which break down into uric acid, you can end up with a buildup of xanthine instead, which can then crystallize out if the dose is too high.
So treating one problem might lead to another if not managed carefully.
Exactly. There's also a very rare inherited condition called primary xanthinuria, where the body lacks that enzyme naturally. This has been seen in some breeds like Cavalier King Charles Spaniels, and also in cats.
Wow, breed-specific again. Genetics seems to pop up quite a bit.
It really does for some of these metabolic stones and crystals. Then we have a collection of other, less common crystals. Cholesterol crystals they look like large, flat plates with notched corners.
Notched corners, okay.
You might see them in situations where there's significant tissue damage or breakdown near the urinary tract, or in a kidney condition called nephrotic syndrome, or a rare condition called Crystalluria involving lymphatic fluid in urine. But confusingly, they can also occasionally be seen in healthy dogs.
So another tricky one.
A bit, yes. Hippuric acid crystals are quite rare in animals, and frankly, we don't really understand their significance. Leucine and tyrosine crystals are amino acids. Leucine might show up sometimes alongside cysteine crystals in cystinuria. Tyrosine crystals, which look like fine needles in clusters, are more commonly linked to severe liver disease in humans, but they're rare in animals and can sometimes be mistaken for certain urate crystals.
It really is a detailed microscopic world down there. And you mentioned another genetic one earlier, 2-col-8 something.
Yes, 2-cal-8 dihydroxyadenine, or 2-cal-8 DHA. These look like round, brownish structures, sometimes called Maltese crosses under polarized light. Finding these is a key indicator of a specific genetic disorder involving a deficiency in an enzyme called adenine phosphorybosyl transferase, or APRT for short. This deficiency leads to a buildup of adenine, which gets converted to the highly insoluble 2-vari-ADHA. We see this in certain dog breeds, and it's been found in wolves too. It causes stones that look a lot like urate stones on imaging, so identifying these specific crystals is crucial for the right diagnosis and treatment.
Incredible how specific these can be. And just to round it out, the drug-induced ones again.
Right. Besides the ones we mentioned, like sulfonamides and fluoroquinolones, you can also see crystals from radiopaque contrast agents used in X-rays or CT scans, primidone, an anti-seizure drug, xanthine oxidase inhibitors like allopurinol, and even some older antibiotics like tetracycline if given in high doses. So always need that medication history.
It's just astounding how many different types there are and how each one can potentially provide a clue, sometimes very specific clues. So when a urine sample arrives at the lab, what are the technicians looking for besides just, yep, they're crystals?
Well, they'll definitely note the type based on morphology, the shape, but they also look at other things. For instance, they'll take into account if the person or animal is taking any medications that could potentially interfere with the urine tests themselves, like urinary acidifiers or alkalinizers.
Oh, right.
Even some drugs like phenothiazines, tranquilizers, or phenazopyridine, a urinary pain reliever, can dramatically change the color of the urine, which is important context.
Yeah, that bright orange color from phenocipurity.
Exactly. They'll also compare the crystal findings with other results, especially from blood tests. For example, if they see bilirubin crystals, they'll likely check the blood work for other signs of liver problems, like elevated liver enzymes or bilirubin levels.
Okay.
If they see calcium oxalate or calcium phosphate crystals, they might look at the blood calcium levels, although those aren't always abnormal. Sometimes individuals with calcium oxalate issues might have slightly more acidic blood, metabolic acidosis, so it's all part of putting together a bigger clinical picture.
So it's definitely not just an isolated finding. It needs to be interpreted in the context of everything else going on with the patient.
Precisely. And ideally, especially if crystalluria seems significant, they'll want to examine fresh urine samples, maybe multiple times, serially. They'll note not just the type of crystal, but also, roughly how many there are: few, moderate, many, what's their average size, what's their specific structure or shape like, and, as we discussed, are they tending to clump together?
Right, the clumping.
While looking under a standard microscope gives us a good initial tentative idea of the crystal type based on shape, definitively identifying them often requires more specialized techniques.
Like what?
Things like optical crystallography, which looks at how the crystals interact with polarized light, or infrared spectroscopy, X-ray diffraction, or even electron microprobe analysis. These methods can provide a much more precise chemical fingerprint of the crystal's composition, which is crucial if the shape is mythical or if it's a mixed situation.
That sounds like some pretty advanced technology for looking at something so tiny.
It is, but it's sometimes necessary for accurate diagnosis, especially when it guides treatment. And there are also specific chemical tests that can be done right there in the lab, depending on what type of crystal is suspected.
Oh.
For instance, there's a test called the cyanide nitroprusside test that turns purple if cysteine is present. A lignin test can suggest sulfonamide drugs might be the source of some crystals. Adding a drop of acetic acid to the urine under the microscope can help distinguish certain types urate crystals might dissolve, for example.
Oh, chemical clues.
Yep.
Yeah.
And the fact that struvite crystals are often associated with those urease-producing bacteria we talked about is another important clue the lab considers, maybe correlating with results from a urine culture. In cases where ammonium urate crystals are found, the lab might also check bile acid levels or ammonia levels in the blood to look for those liver shunt issues. And of course, if ethylene glycol poisoning is suspected with those calcium oxalate monohydrate crystals, there are specific blood tests to detect the toxin itself. It's also worth remembering a key difference for distinguishing in the lab. While cysteine, hexagons, and struvite, coffin lids, can sometimes look a bit similar if they're not perfectly formed, cysteine won't dissolve in acetic acid, whereas struvite generally will. Plus, that nitroprusside test will be positive for cysteine, negative for struvite.
So the lab has this whole toolbox, visual and chemical, to really nail down what they're seeing.
Exactly. They play a crucial role in not just seeing the crystals, but also in definitively identifying them and helping understand their potential significance.
Does imaging, like X-rays or ultrasound, play a role in all of this as well?
Yes, absolutely. The presence of crystalluria, especially significant or persistent crystalluria, can often be associated with the formation of larger urinary stones, uroliths, that might actually be visible on imaging.
So the crystals are like the smoke, and imaging looks for the fire.
That's a decent analogy. If crystals are detected in the urine, particularly types known to form stones, the next logical step in the diagnostic process might be to image the urinary tract, the kidneys, ureters, bladder, urethra, to see if there are any larger stones already present. The crystals can be like the early seeds, the building blocks, that eventually grow into those macroscopic, visible stones.
Okay, so we found the crystals, maybe we've identified them, we understand the potential risks. What happens next? How do we figure out what's actually wrong and how to address it?
Well, sometimes, if actual stones are present, but they're very small, a procedure called voiding urohydropropulsion can be used.
Voiding urohydro what now?
Yeah, it's a mouthful. Voiding urohydropropulsion. Basically, they fill the bladder with sterile fluid and then gently express it, hoping to flush out tiny stones or gravel for analysis. Alternatively, sometimes a catheter can be passed into the bladder to try and aspirate small stones or sediment. Getting a sample of the actual stone material for analysis is the gold standard for knowing exactly what you're dealing with.
Okay, getting the stones out for testing.
But ultimately, managing clinically significant crystalluria, the kind that's likely causing issues or posing a risk, involves identifying and treating the underlying cause and any factors that are increasing the risk of crystal formation. It's not usually enough to just make the crystals temporarily disappear from a single urine sample.
So you're not just treating the symptom, the crystals themselves, you're trying to fix the reason they're forming in the first place.
Exactly, that's the goal. General strategies to help minimize crystalluria often include things aimed at making the urine less saturated and flushing things through.
Like drinking more water.
That's a big one. Increasing the volume of urine by encouraging more water intake is key. This dilutes the concentration of those crystal-forming substances. Encouraging more frequent urination also helps, so the urine doesn't sit around in the bladder for too long, giving crystals time to form and aggregate.
Makes sense. Keep things flowing.
Dietary changes can be really important too, but it depends heavily on the type of crystals that are forming. For example, for urate crystals, a low purine diet might be recommended. For struvite, sometimes diets that help acidify the urine are used, along with treating any infection. For calcium oxalate, it's more complex, often involving managing calcium and oxalate intake and promoting dilute urine.
So the diet has to match the crystal type.
Absolutely. And specific medications might be needed: antibiotics for infection-related struvite, medications to alter metabolism for cysteine or urate, drugs to help prevent calcium oxalate formation. And in some situations, as mentioned, we might use medications or diet to adjust the pH of the urine, making it less favorable for certain specific crystals to form. It really is a very tailored approach based on the individual animal or person and the specific crystal type involved.
It sounds like it requires a very individualized treatment plan, definitely not one size fits all. And what about follow-up? How do doctors and vets monitor if the treatment is actually working over time?
Regular urinalysis rechecks are essential.
Checking the pee again.
Yep. To see if the crystalluria is persisting, or hopefully if the number and type of crystals are decreasing or have disappeared in response to the treatment plan. If a diagnosis of actual urolithiasis, urinary stones, has been made, then the monitoring will follow the specific guidelines for that particular type of stone. That might include periodic imaging, like X-rays or ultrasounds, to see if existing stones are dissolving or if new ones are forming.
Okay.
It's also really important to be aware of the potential complications of persistent, significant crystalluria. The main one is that it can contribute to the further formation and growth of larger stones. And in some cases, particularly in males with narrow urethras, the accumulation of crystals and mucus can actually form a plug and lead to a blockage of the urethra.
Oh, that sounds serious.
It's a medical emergency. It means urine can't get out, which can lead to kidney damage and severe illness very quickly. So ongoing monitoring and management are crucial to prevent these complications.
So even these seemingly insignificant microscopic crystals can really have potentially major consequences if they're not properly understood and managed. This has been a truly in-depth exploration into the world of crystalluria. Thank you. To sort of bring it all together, what would you say is the most important thing for our listeners to take away from this discussion?
I think the key thing to remember is that finding crystals in urine is a complex piece of information.
Yeah.
It really requires careful interpretation. We absolutely need to consider both what might be happening inside the body, the in vivo factors like concentration, pH, metabolism that's leading to crystal formation,
Right.
as well as any changes that might occur in the urine sample after it's been collected, the in vitro factors like temperature and time.
Okay, both inside and outside matter.
Exactly.
Yeah.
And crucially, the specific types of crystals that are present provide incredibly valuable clues. They can point towards underlying metabolic processes, possible toxins, infections, dietary issues, or even specific genetic predispositions.
So while maybe the occasional crystal might be nothing to worry about, seeing certain types or seeing large numbers consistently, that can be a really important indicator of underlying health issues or a significant risk factor for developing those painful urinary stones. It's definitely something to pay attention to if it shows up on a report for you or your pet.
Precisely. Getting an accurate identification of these crystals and understanding the full clinical context in which they are found is absolutely essential for guiding the right diagnostic path and the right medical approach to ensure the best possible outcome.
Well, on that note, it's just amazing to think about how much information can be gleaned from these tiny, often overlooked structures in urine. It really highlights the incredible complexity of the body and, frankly, the value of careful observation, even right down at the microscopic level.
It really does.
So let's maybe leave you, our listener, with this final thought. Consider the dynamic nature of something like urine and crystal formation. how seemingly small changes within us, maybe our hydration, our diet, our metabolism, or even just how a sample is handled after it leaves us, can have really profound implications for what we observe under a microscope and ultimately what we understand about our health. It makes you wonder, doesn't it, what other seemingly insignificant details and all sorts of aspects of our lives might be holding important clues that we haven't yet fully appreciated.
That's a great point to ponder.
Thanks for taking this deep dive with us.